You probably think that measles is a thing of the past. It's something old folks tell the younger generations to make the latter feel like they're less tough than their seniors, because these seniors went through a lot. War, famine, measles. If anything, you can tell the older ones in your support system to please, with all due respect, suck it. Measles isn't gone, and they're not that special. In fact, measles is oh so back. There's even a recorded surge of measles cases as of late. That's the reason why this video exists, to let you in on what you need to know about this subject. Now, before you click X in favor of another video with cats and whatnot, keep this in mind. Measles can be fatal. Watching through the entirety of this video could very well save you or your loved ones. Later, we'll discuss the current surge in measles cases. So stick with us until the end of the video. A surge in measles cases. I'm sure you've heard about obsolete diseases. Think polio, for example. It's something you know for sure will never come knocking on your door. Now, if you've classified measles within that category of health concerns that are no longer of concern to you, you got it all wrong. We'll tell you later how vulnerable you are to this disease in terms of percentage. Stick around for that potentially life-saving information. Meanwhile, let's discuss the current state of affairs measles-wise. In 2023, there were only 58 reported cases throughout the United States. This year, and we're not even halfway through 2024, we've already tallied 64 measles cases across 17 states. That number is no laughing matter. It means the disease is spreading. Just how vulnerable are you to measles? Let's put it this way. If there are 100 people exposed to the measles virus at the same time, 90 of those will get infected. That's a 90% probability. If you find that percentage scary, there's no reason to panic. Later in the video, we'll give you tips on how to protect yourself against measles. How to avoid measles. Now, you might be wondering how measles cases surge. The short answer is that the MEV virus is super contagious. If you find yourself in a room with an infected person sneezing and coughing, you could inhale oral and nasal droplets carrying the virus. That's enough to make you sick, especially if you're immunocompromised. Do you find what we've discussed so far helpful? Tell us about your thoughts in the comments section below. Now let's go to measles avoidance. What can you do to protect yourself from this viral infection? For starters, you need to get vaccinated with MMR. Administered in 2 doses, the MMR vaccine has proven effective at measles prevention. Other precautionary measures include proper hygiene and avoiding contact with infected individuals. You also need to follow protocols during outbreaks to help your local government contain the disease. Last but not least, self-isolate once you show symptoms so you do not contribute to the rise of measles cases. Don't let measles be the only thing spreading. Subscribe for more contagious health content and updates. But what if it's too late? What if you already have the virus in your system? What symptoms should you look for? That we'll know later in the video. For now, let's get this out of the way. The MEV virus can stay for up to 2 hours after the disease carrier vacates an area. The virus remains contagious 4 days before symptoms and 4 days after skin rashes appear on the infected individual. Measles symptoms. If you suspect you or your loved one has been exposed to the MEV virus, be wary of the changes in your body. Symptoms to look out for include fever, cough, runny nose, sore throat, and red eyes. You might also develop Koplik spots, which are small white spots on the insides of the cheeks. Lastly, watch out for those rashes that might spread from your face to your legs. That should confirm that you do have measles. Now, would you like a measles trivia that'll make your head explode like missiles? If yes, stick with us a little longer. Time for a quick FYI. Measles symptoms appear between 8 and 12 days after exposure. However, there have been instances when a patient began seeing symptoms after 3 weeks from exposure. That means you cannot be complacent, and you need to be conscious of your body. Are you ready for that trivia? Did you know that in the year 2000, the United States was declared measles-free after a successful vaccination run? Unfortunately, that didn't last for good. Now we're back to having measles in our midst. Have you had a bout with the measles before? If not, are you scared of contracting the disease? Let us in on your thoughts in the comment section below. If you found this video valuable, imagine what else you could learn by subscribing. Stay informed, stay engaged. Hit that subscribe button.